Okay, so this is a great topic because everybody's interested in food and eating. I don't know how much of this audience is diabetic or pre-diabetic. Maybe a show of hands for those who are diabetic? You don't mind? Okay, so a fair number of you may be pre-diabetic or interested in preventing diabetes. And so we'll cover both of those issues. Okay, so just a framework for this talk. We're first going to talk about some big aspects of diet, sort of macronutrients, carbohydrates, protein, and fat, and different types of diets that you may have heard a lot about and what the studies show in terms of their effect on diabetes. Then we'll talk about glycemic index. I don't know if you know what that means, but we'll get into definitions. And then we'll get down to the micro and talk about specific foods that may be healthy for you and what foods should be avoided. And finally, the actual reversal of diabetes. Okay. Some of you may recall food pyramids. This is the one from 2005, which uprooted the one in the upper right corner, the black one, which is the old food pyramid. The major change you can see is that, the bread and grain and cereal section has diminished here. So it's a smaller piece of the pie, and the fruits and vegetables are a bit larger. And I think that's because people were eating the wrong kinds of grains and cereals. So Wonder Bread and all the many sweets that are in our diet really aren't what we wanted here. So I think that USDA recognized that we were becoming more obese. This is potentially a future food pyramid at the rate we're going. And this is sponsored by the Association of American Corporations for Freedom of Choice in Food. Okay. I threw this in there because I'm a fan of Dr. Andrew Weil's philosophy. He's a big believer in not just healthy foods, but anti-inflammatory foods. I don't know how many of you are familiar with Dr. Weil. So he's an MD, but also interested in naturopathic medicine, I guess one would say, herbal medicines as well. And so some of the things he pitches for anti-inflammatory effects are fish oil. He's also big on turmeric and a lot of spices. And also fermented foods. He's very big on a whole host of fermented foods, not just, they're probiotic rich essentially. So that's of interest if you're. This is the new modified and simpler concept that has replaced the pyramid. And Michelle Obama came up with this with the head of the FDA in, I believe, 2011. So the key thing here is you keep seeing that fruits and vegetables are gaining, I guess this isn't working. Fruits and vegetables are now 50% of the plate. So I think the recognition that these are the important aspects of our diet, the healthiest, the lowest calorie, and the grains keep getting smaller here. Okay. We're going to first start talking about fiber. How many in the audience here think that they're eating enough fiber? Wow, that's really pretty high. So we'll come into the specific recommendations. What is fiber? Fiber is not just the cellulose things that we think about, like celery and the really fibrous types of vegetables, but rather also polysaccharides, which are complex carbohydrates that are not digestible in the small intestine, and hence make their way down to the colon, where they're processed and fermented. And so these can also be synthesized in additive foods, so psyllium and metamucil are synthetic fibers. But the major sources of fiber are not just whole grains, but also fruits and vegetables. We can also talk about fiber in terms of soluble versus insoluble. Soluble fiber is generally fiber that makes a gum-like substance in the intestines. So if you've ever had Metamucil, you'll know it kind of makes this gummy stuff in water. Other foods do that as well, and those are termed soluble fibers. So apples are a very common one. It's got pectin in it, which does a similar fashion to the psyllium. Carrots, lentils, oats, and oatmeal, and that would be best bet there is steel-cut oats and not sweetened oatmeal packages. Okay, so the recommended fiber by the Institute of Medicine is 14 grams of fiber per 1,000 calories. So that means for somebody on a 2,000 calorie diet, that's almost 30 grams of fiber a day. So that's quite a bit of fiber. Actually, more than 90% of the US does not eat adequate fiber, according to some NHANES data, which we'll show you. So this room is not typical. This is a graphic illustration. On the left, you see the men. And on this side is women. And the black bar represents the amount of fiber intake estimated by dietary questionnaires. And the gray is the recommended based on estimated caloric intake. So about 50% for most of the age ranges. However, middle-aged to older women do the best. So maybe they're having more issues bowel-wise or something. Okay, so whole grains, that term is, I think, a little bit confusing sometimes because a lot of products use various definitions when they say something is whole grain. The whole grain consists of 3 parts: the bran, the germ, and the starchy endosperm. And this is a picture of that. So over here, this is the germ. This is like the egg of the plant. And then this endosperm is the starchy stuff. And then the outside is the bran layer. This, if you keep this all intact or as part of the product, you have a lot more fiber and a lot more nutrient impact. What happens with most milling processes is that you're taking this endosperm and just taking that stuff out and grinding it up and putting it into white bread. And the problem is that this lacks a lot of the vitamins and minerals that you find in these other components, and a lot of the fiber is gone. There's still some fiber, but a lot of it's gone. And the reason that the milling is done is that it gives a longer shelf life to products, and it's more palatable. It tastes a little better for some people. Okay, so that's the basic on whole grain. And what are some whole grain sources? Well, wheat you know about. It's gotten a bad rap lately. There's a lot of anti-wheat books out there now. But whole wheat is not bad for you, I don't believe. Oats, barley, brown rice, maize or corn, rye, millets, and some fibers that I don't really see out there too much, sorghum. Then we also have some pseudo-cereals, which include amaranth, buckwheat, and quinoa, which is making a real, has become very popular. It's a Peruvian grain. Okay. I pulled this out of the internet, but I thought it was kind of interesting in terms of thinking about when you see a product and you look at the back of it and you look at the ingredients, is it really a whole grain product? And so the sort of yellow zone here, these are things that really are bona fide whole grains. So if you see whole wheat, whole whatever, or oats, these are all whole wheat, whole grain products. And then a lot of these other things are partially whole wheat. And then down here we have bran, enriched flour, wheat germ, and so forth. These are just partial ingredients of that. And then this is more of a relative scale for people if you're interested. I just thought it was interesting to kind of see that barley sort of surpasses all, and rye is also like the highest dietary fiber among the grains. And then wheat and oat are behind that. And rye is not really very popular here, but it's very popular in Scandinavia. This, again, compares fiber intake across various other types of foods, including fruits and vegetables. And what I would highlight here is that beans and legumes are really the best source of fiber, which I think most of us think of breads maybe, or cellulose like in celery. But this is really high amount of fiber grams per serving. So we should all be eating more beans. I can say that with confidence. Okay, so why am I pushing this so hard? Well, fiber protects against weight gain. So it makes you feel full, and so you're not going to eat as much. It promotes GI motility. And then interestingly, it blunts the absorption of glucose. And so many of you may know this, but when you eat something with a lot of fiber, your glucose is not going to spike as rapidly as it would carb for carb. Okay. It's going to promote healthy flora in your colon. We talked about how these fiber things are not digested in the small intestine, so they're going to make it down to the colon. And that is felt to be helpful in terms of the colonic flora and potentially has downstream impact on hepatic glucose metabolism. They reduce cholesterol, in particular soluble fiber, reduces LDL, so that's pretty exciting. They're rich sources of nutrients, and we mentioned minerals. So they help prevent diabetes, and maybe they might even decrease mortality. Okay, I'm not going to go into the busyness of the slide, but bottom line is that this was a trial where they looked at diabetics, and these were women, and they looked at cardiac mortality for various types of whole grain intake. And what they found was that by and large, the highest quintile of people in terms of their intake of fiber had about a 20 or 30% reduction in their cardiac mortality. So that's pretty striking, I think. And then they looked at total mortality as well, which paralleled that finding. And some of these were not statistically significant, but the trend was there, that those in the highest quintile as compared to the lowest quintile had decreasing rates of mortality. another European study. They like to study fiber in Europe for some reason. So it's another European study. And this is adjusting for other factors. So the fact that, okay, we know that people that eat more fiber are not as obese. They adjusted for that. They adjusted for all the factors that they could think of that would be so-called confounders. And they came up with still a 17% reduction in mortality. So I think that's really interesting. Okay, then we'll come to the prevention side. Can fiber prevent diabetes? And the answer seems to be yes. Again, we're looking at quintiles of fiber intake, and this is not showing any benefit, but if you look here at the other components here, fiber, this is magnesium, they looked at magnesium too. Fiber, soluble fiber, and insoluble fiber. And here you see some of these are not statistically significant, but again, the trend is there, and this is statistically significant here on the soluble fiber, about a 20% reduction in diabetes risk. And again, similar findings for this. Okay, another study out of Stockholm. More than 60 grams of whole grain intake versus less than 30 had a 22% lower risk of diabetes and prediabetes. And this study was unique because they looked at pre-diabetics as well. So, you know, they made adjustments, BMI among others, and once again. So these are very consistent findings that we see about 20% reduction in diabetes and prediabetes. So I would conclude that fiber is an important component of the diet. It likely delays or prevents diabetes based on these cohort studies. If you do get diabetes, you're less likely to die from cardiac or other diseases. It helps keep your weight down, it helps your glucose control, it helps your cholesterol. And also some of you may have heard that fiber can reduce the rate of colon cancer. And it's inexpensive in many cases. So we pretty much all need to be doubling our intake if we are average US population, which we don't seem to be, but okay, we're gonna shift gears and talk about red meat. This is a study published last year, which showed that those who increased their red meat intake by more than a half serving a day over a 4-year period had a 30% higher rate of developing diabetes in the subsequent 4 years. So this was kind of an 8-year investigation of data. So they did diet questionnaires over a 4-year period of time and then followed them 4 years longer and said who got diabetes based on what they were doing over here. And then they looked conversely, they found that if you reduced your red meat intake by more than a half serving per day, you reduced your risk of diabetes by 14%. So that's pretty exciting too. And this is a graphic illustration. Over here, we'll see what the low red meat intake, those were people that were low red meat intake at baseline. And then these graphs show over the 4 years, what did they do with their diet? So in this black line, we see people that started out low, that became high red meat intake people, went from a risk of 1, which is sort of the null risk, to a 2 risk, meaning they doubled their risk for developing diabetes. And you may ask what was low and what was high. So how many of you in this room eat meat less than two servings a week? Raise your hand. Okay, so you're all in the low group. So less than 2 is defined as low red meat intake, and more than 7 was high, and 2 to 7 was medium. Okay. So less red meat. French study, and this showed, interestingly, that they found that for processed meat, there was a significant increase in risk of diabetes, but not for unprocessed meat. Okay, good question. So processed meat is luncheon meat or meat that's added products like salt and sulfites and other compounds to make that meat last, and the bologna, the hot dogs, the bacon, anything that's been processed and isn't straight off the cattle. I mean, anything that has processed. Well, actually, let me just say one more thing. Why do people think that red meat might be harmful in terms of diabetes risk? Well, exactly. So the absence of fiber may be one thing, right? You're eating red meat instead of eating the healthy things. So it might just be that. There's another theory proposed, which is that the nitrite compounds in bologna and processed meats are converted to a compound called nitrosamine, which is directly toxic to the beta cell of the pancreas. So there's actually an interesting biological explanation. So that's true for processed meats, and for organic grass-fed beef, the risk is probably less. But there may be other risks as well. And we know that red meat has a lot of saturated fat. So we know it's bad for heart disease and cholesterol. And we know that it's associated with more weight gain over time. So I think there's some other reasons as well. It may be associated with obesity. But some of these studies try to control for obesity. So there's something intrinsic probably to red meat, especially processed red meat. Yeah.
But as a result of cooking, so you raw meat shouldn't be brown.
Yeah, so if you fry your bologna, it's worse, probably. So, yes. And if you char your red meat on the grill, there are more either also carcinogenic compounds that form as well. Okay. So a vegetarian diet, let's talk about that a little bit. Why might this be a good diet? Well, we've talked about how fiber is so great, and most vegetarian diets are high in fiber. And so we know it's going to blunt the post-meal rise in your glucose. It's going to help with your diabetes management. We've done studies that show that vegetarians are thinner than non-vegetarians because they eat fewer calories. They're getting full easier because they're eating so much fiber. So they actually have lower calorie diets. They also have lower LDL cholesterol and a lower rate of heart disease, which is the number one cause of mortality for probably everybody, but diabetics have about a 3-fold increased risk of heart disease. So we should all be worried about heart disease, but especially diabetics. And then for those of you that may have kidney problems, a vegetarian diet may be better than a meat-laden diet just because the high meat protein may be involved in progression of the kidney disease, although that's not really entirely proven. And then, again, we have a lack of red meat with a vegetarian diet, and red meat we saw as a problem. Okay, so this is a study of Seventh-day Adventists, and they've done like 3 large cohort studies on this group. So again, when I keep saying this term cohort studies, that means it's not a randomized trial. A lot of these diet studies are not randomized trials because it's hard to get people to commit to long-term adherence to one diet or another. People want to do what they want to do. But cohort studies mean that we just measure a bunch of variables on a big group of people. We measure a bunch of lab tests and so forth, and then we follow them over a big span of time. And we look to see that based on the baseline characteristics, what happens to them. We're not intervening on those patients, we're just following them and looking at risk factors and associations. And when they do these cohort trials, they try to control for other things. But sometimes there's unmeasured, what we call confounders. So cohort studies in the world of medicine are not favored. We prefer randomized control trials, but this is as good as we get for a lot of diet studies. So in the Seventh-day Adventist group, they pitch exercise 3 days a week, a diet high in beans. They propose that people eat a vegetarian diet, but not all Seventh-day Adventists adhere to a vegetarian diet. So they're a pretty healthy group on the whole. But then we can look at their BMIs and their rate of diabetes and hypertension based on their vegetarian status. So vegan means they don't eat anything that's not vegetarian. So they don't drink milk, they don't eat fish, they don't eat eggs. Okay. So their BMI is the lowest, 23, versus the non-vegetarian, which was 28. Diabetes risk, we set this to 1, so we compare it to the level of 1. So this is really shocking. This is 0.22. So this means about an 80% reduction in the rate of diabetes with a vegan versus non-vegetarian. Now again, cohort trial, maybe there's a lot of unmeasured variables. Hypertension, set this to 1, 0.25. So that means a 75% reduction in the rate of hypertension. And then again, you see sort of a progressive decline in the BMI depending on semi-vegetarian, pesca-vegetarian, lacto-ovo-vegetarian. Yes, body mass index, which is computed based on your body weight relative to your height. Okay, then again, Seventh-day Adventist data, 12% lower risk of mortality. So we already said they're thinner, they have less diabetes, and they have less hypertension. Now we've seen that they don't die as often, which kind of follows. But interesting here, you see 12%, 15%. The pesca vegetarians had the lowest mortality. So that makes me wonder, well, maybe fish isn't so bad to add to the vegan diet, because fish oil may be good, the omega-3s are good. And similar trends across cardiovascular mortality. A little bit more beneficial in men than women for some reason. Okay, here is actually one diet trial. So this is a randomized control trial. Again, not too many of these, and probably one of the only I was able to find for vegetarian diet. And they compared the vegan diet to the ADA, or American Diabetes Association diet. It was a 1.5-year study, and the A1C was compared in the vegan group versus the ADA diet group. And their A1C was slightly lower So that's pretty good. The fasting glucose fell by more in the vegan group, 14 versus 7. Total cholesterol fell more. LDL fell more. Weight loss was not statistically significant. So basically both groups lost approximately 8 or so pounds, and there was no difference. Okay, so let's summarize on vegetarianism. It's associated with lower total and cardiovascular mortality based on the cohort studies. It seems to prevent obesity, hypertension, and diabetes, again, based on cohort. And it reduced the weight in the one randomized trial of type 2 diabetics, even though this was a diet of 70% carbohydrate. So I bring that up because low-carb diets are in fashion right now. And I think it's important to note that you can still eat vegan and eat a high-carb diet as long as you're picking the right carbs. It's just that so many people pick the wrong carbs that they need to be on a low-carb diet to lose weight. Does that make sense? And then you had a lower glucose, lower cholesterol than the ADA diet. Okay, this is another great study that was published last year. Some of you may have heard about this Mediterranean diet study. It was a very large, and it was a randomized control trial in Spain. Almost 8,000 patients all over Spain were recruited. These were not all diabetics. They either had to have diabetes or 3 cardiac risks. And they randomized people to 3 arms. You could either be in the Mediterranean diet plus olive oil added, the Mediterranean diet plus nuts added, or a control group. Okay. These are the details. I don't know how well you can see these, but for the Mediterranean diet, this is the upper half. They were supposed to eat more than 4 tablespoons a day of olive oil, more than 3 servings a week of tree nuts or peanuts, fresh fruits more than 3 a day, vegetables more than 2 a day, fish more than 3 a week, so quite a bit of fish. Legumes, again, this is really big. Greater than 3 a week of legumes, which are beans or lentils and that sort of thing. Sofrito, which is a garlic and tomato-based sauce, more than 2 servings a week. White meat instead of red meat. Wine with meals, this was a Spanish study. They had to have more than 7 glasses a week. It says optionally, only for habitual drinkers. Discourage soda drinks, discourage commercial bakery goods, sweets and pastries, discourage spread fats and red and processed meats. And then the low-fat diet was a control diet. So they were supposed to be on a low-fat diet, but they could eat the bread and the potatoes and the pasta and rice. And they discouraged vegetable oils, commercial bakery goods, and so forth. They discouraged them from eating, the control group, from eating nuts and from eating fatty fish. So they said, we want to take away your fish and take away your nuts because we want to see if there is a difference. Okay, this is pretty impressive for a diet study, really. This is showing the control diet is the black line, and this is a 5-year study roughly. So this is years on this axis. And up here we see the total composite endpoint, which included cardiac death, heart attack, stroke, just everything sort of combined into one. Control diets here, Mediterranean diet, whether it was the nuts group or the olive oil group, there was a 30% reduction in mortality. It was really impressive. And the stroke reduction was 40%. So, I mean, here's total mortality. This was the cardiac endpoint, and then the total mortality. This did not show a statistically significant difference, but you can see the lines are coming apart here. So there may just have been not quite enough people or long enough time to see, but there may be a difference here, but the total mortality wasn't statistically significant. Okay, so now we'll move on to low carbohydrate diets. This trial I threw in here because it was one of the larger diet trials in the last few years. It made a lot of headlines, and it's not a diabetic trial, so I want to make sure you're aware of that. But it was a trial looking at what's the best diet for overweight middle-aged women that want to lose weight. And so they compared 4 different diets. And the Atkins diet was one of them. And the Atkins diet was really popular several years ago. Some of you may know what the Atkins diet is. It was a diet high in protein and particularly red meat. So you could eat as much bacon as you wanted. And people loved this diet. So I'll sign up for that. And then they compared it to the Zone diet, which is 40% carbs, 30% protein, 30% fat. Learn diet, which was a low-fat diet. And then Dean Ornish diet. And he's the guy who's big on veganism. He claimed that his diet could reverse coronary disease and showed so, and actually showed some reduction in coronary plaques with some coronary angiogram part of his studies. So he's a very low-fat guy. It's a little harder to adhere to his diet because it's a less than 10% fat diet. And these guys both came out with books and were popular, each of them. This is the summary graphically of what happened. Again, this is out to 1 year. So the orange line is the Atkins, or I guess it's, yeah, orange. The Atkins diet lost about, and this is kilograms over here, so we double that to make pounds. So about 5-pound weight loss with Atkins, 10-pound weight loss with Atkins versus 5 pounds with these others. So everybody said, great, Atkins is better, but it wasn't statistically significantly different from these two. It was only statistically significant different from the zone diet. So perhaps the weight loss was a little bit better with Atkins. Does that mean I recommend Atkins? No, because Atkins is very high in saturated fat and red meat. And what we really care about is longevity, I think, and not just weight loss. Okay, so how do I put all these things together? I've given you a lot of data. What kind of diet is best for me? This trial tried to, we say in meta-analysis, it tried to combine a lot of data from a lot of different studies. And it looked at 20 different randomized control trials and pulled almost 4,000 individuals and all their data and compared low glycemic, low carbohydrate, Mediterranean, low fat, ADA, high protein. The problem is there were varying definitions of what was a low glycemic index diet and what was a low carbohydrate diet. So I think it's difficult to tease this data together, but in general they found that the Mediterranean and low carbohydrate diet seemed to be favored as far as weight loss. And all of them really, the low carbohydrate and low glycemic index and the Mediterranean and high protein diet all led to greater A1C reduction than other diets. Okay, so I'm going to summarize now. Vegetarian diets, we said, are rich in plant nutrients. They help with weight loss. They're high in fiber, and they're associated with low mortality and better glucose control. So I think for anybody who's interested in that, I think it's a wonderful diet. The Mediterranean diet is another great diet. Lower A1C weight loss and lower rate of cardiovascular mortality and stroke was seen, and that was for that randomized trial, whereas the vegetarian data is largely from, as I said, cohort studies. And then the low carbohydrate diet is also associated with lower weight loss and lower A1C than control diets. And that the Atkins diet, as I said, did show a little bit more weight loss compared to zone, but it's probably not a heart healthy diet. But I think we can jump from that and say that for some people, higher protein and lower carb may be good for weight loss. And leading into that, this is looking at adherence. So they pulled data from that A to Z trial, which is the Atkins study, and they collected blood samples and then measured fasting insulin. Now, I already told you these were not diabetics. These were women that were overweight and maybe heading that way, but they weren't. And then they tried to define who was insulin sensitive versus who was insulin resistant. So insulin sensitive were people that had low insulin levels, fasting insulin below 7. And those who were insulin resistant were fasting insulin greater than almost 11. And naturally, the people that were insulin resistant were on the large more obese than the people who were insulin sensitive. And I'm going to summarize this. Let's see if there's anything I want to say here. Oh, I do want to point out on this slide that the fasting insulin level, so if you look across here, there really isn't much change in the fasting insulin level, except in this one column, which is the low carbohydrate diet for the insulin resistant folks. So if you have a high fasting insulin and you're on a low carb diet, you're going to lower your insulin level, whereas the other groups didn't really see a change. And then this, I think, is striking. So this is to look at how much weight loss, if you tease out that data for those that are insulin resistant versus insulin sensitive, how do they do on the different diets? On the low fat diet, the insulin sensitive folks lost about 4.3 kilos on average, and on the low carb, 4.9. So that's not statistically significant, those differences. However, if you look at the insulin resistant folks, low fat diet, they only lost 2.2 kilos. And on the low carb diet, they lost 6.2 kilos. So to me, what it means is that there's heterogeneity among folks, and that people that have insulin resistance probably do better on the whole with a low carb diet, probably due to adherence factors. That's what I would conclude. Okay, now we're going to get a little more micro and talk about healthy foods within the macronutrient classes. So that would be carbohydrates, protein, and fat. What are good fats? Nuts are very good. They're high in calorie, but they're very healthy. Walnuts and almonds are especially high in omega-3. Olive oil, we've said this olive oil study was tremendous in terms of lowering mortality. Fish oil and flaxseed oil, more omega-3. MUFAs, which is monounsaturated fatty acids. Avocado and nuts are rich in MUFAs. Canola oil, depending on who you talk to, if it's healthy canola oil without oxidation. And then coconut oil is interesting because generally we say that saturated fats are associated with more cardiac disease, but some people believe that coconut oil may be a unique example of a healthy saturated fat. Okay, bad fats are most saturated fats. So full fat dairy, red meats, cheese and butter, trans fats, which stick margarine and additives. I believe the law that came out said that you had to label or eliminate trans fats, but I think that if you have less than 0.5 grams of trans fat in a serving, and maybe Jessica, you can help me, if there's less than 0.5, it can be claimed to be a zero trans fat food if it's less than 0.5. So it may still have a little bit of trans fat in it. So it can sneak up on you there. Corn, palm, safflower, and other oils that are polyunsaturated and not omega-3. So this omega-3 just refers to where the double bond is on the molecule. So polyunsaturated means there's lots of double bonds and it's not in the 3 position. Especially when you deep fry these kinds of oils, they form a lot of free radicals, and these are probably horrible for the vascular tree. Good protein, soy protein. Andrew Weil is big on tempeh, miso, and all things Japanese and fermented. So any of these, soy sauce doesn't really count. Okay. Beans and legumes, nuts and seeds, lean poultry, fish, and then eggs and shellfish in moderation because they are high in cholesterol. Bad protein, red meats in excess, processed meats we all agree on, bacon, hot dogs, cold cuts, bologna, and so forth. So again, all those studies showed that this was bad for diabetes risk, whereas the French studies showed that maybe the red meats that weren't processed were not as bad and not clearly associated. Good carbohydrates, whole grains, watch the labeling. Fruits, watch smoothies. So I have a lot of patients that throw in 5 or 6 fruits into a blender, drink it quickly, and think that's healthy. The sugar load is tremendous. So if you're going to do smoothies, I really tell people it should be largely vegetables and maybe 1 fruit. Because again, it's the rapidity. How quickly is that sugar entering your bloodstream? We talked about fiber blending it, but again, if you just drink a ton of smoothie very fast, it's just too much sugar for your pancreas. Vegetables and beans and legumes. And then bad carbohydrates, long list. Anything in a package or box for the most part. Chips, crackers, any white carbs, white rice, white bread, white pasta, noodles, sodas, regular and diet. Diet sodas are harmful too. And I believe artificial sweeteners are as well. And there was a recent study that showed that artificial sweeteners seem to change the gut flora. Because people say, well, they're 0 calorie, how can they be bad for you? Well, they may change the gut flora in a way that promotes insulin resistance and obesity, both in mice and humans. So I think there is now starting to be some scientific research that backs up the claim that artificial sweeteners are not good for you. Yeah. Sodas, okay, we talked about that. Oh, look at the labeling again, because sometimes they try to mask the sugar on the labeling, and they call it cane juice. And it's still sugar, okay. And then high glycemic index foods, which we're going to go into. Because I think the term gets thrown around, and some of you may not understand exactly what a glycemic index is. Well, by a show of hands, how many of you feel comfortable with understanding the concept of glycemic index? Okay, so basically what glycemic index does is it says, okay, whatever you're eating, we're going to compare how much your sugar rises with that food relative to a piece of Wonder Bread, essentially. So if a Wonder Bread is 100 score, then the glycemic index will be a percentage of that. So a 55 score for an apple, it means it's about a 50% reduction or increase in glucose relative to the slice of Wonder Bread. Okay, so lower is better. Glycemic load is that you take the glycemic index of that food and then multiply by how many carbs you're getting in that food. So you can figure out what your total glycemic load is for the meal or for the day, depending on how sophisticated you want to be. So low GI foods, most people think that 55 or under is a pretty good food as far as not being too glycemic. Medium, 56 to 69, and then anything over 70 means you're over 70% of the, of the rise of glucose with a piece of white bread. And a glycemic load, low for the day would be under 80, high for the day over 120. This looked at the top 20 carbohydrate foods in the Nurses' Health Study in 1984. And funny enough, if you look at all the top 20, almost all of them are 90 to 100 on their glycemic index, except for a few. Apple being number 13 at 55, skim milk at 46. But, I mean, most of these are close to 100. Jam, cranberry juice, pancake is 119. It's more than a Wonder Bread. Candy, 99. French fries, 95. So they're all high glycemic index foods. Okay, anybody see any healthy choices on the list here? Anybody see anything healthy? The yogurt. Okay, so good. Somebody wants to try the yogurt. Yeah, it's Yoplait. So I'm going to say no. So I think the grams of Yoplait yogurt are about 30 grams. Maybe Jessica, is that about right? 36? Okay, so great. So 30 grams of sugar in a Yoplait yogurt sounds like a really healthy thing, which probably trumps like a Krispy Kreme donut. I mean, so my point here is you really got to look at the labels. I mean, there's so many things that sound healthy that have so much sugar in them. Fruit roll-ups have a lot of sugar. Gatorade has a ton of sugar. Crystal Light, again, I don't like artificial sweeteners. Raisin Bran cereal. Coffee creamer has got corn syrup solids and trans fatty acids. It used to, at least, have trans fatty acids. Snack bars, most snack bars are full of sugar. There's a few exceptions, but most snack bars are not good for you. And then Diet Coke, I don't like the artificial sweetener. Have I said that enough? Okay, so which cereal has the highest sugar content among this group of four, and calories as well? Quaker? Okay, what else? Granola. Anybody else want to pick? Chocolate Chex? Chocolate Chex is good? Okay. I'm not promoting Chocolate Chex, but okay, so there were some votes for this and this. Anybody Raisin Bran or? Okay. Well, here you go. Here's the answer. Quaker granola with raisin, 420 calories. I think this was per serving, so I think it might have been a half cup. And then 30 grams of sugar. I mean, this is incredibly high. So I think granola sounds really healthy, and if you make it yourself, it is. But many of the boxes of granola cereal are not healthy. So it actually way trumps the chocolate Chex. I mean, 175 calories for chocolate Chex versus 420. And then 10.5 grams of sugar for chocolate Chex versus 30. I mean, so, yeah. So this, I think, illustrates you must read labels. Breakfast cereals are full of sugar. Okay, I'm going to throw in a couple more studies, and then I'll hand it off to Jessica. I threw in the study because I'm a coffee lover, and so I had to put it in here, which is looking at Nurses' Health Study 2, and Health Professionals Follow-Up Study. So these are 3 large U.S. cohorts that were looked at, and again, they just keep finding and looking at new data and pulling up the data from what they measured on these people. Again, food questionnaires every 4 years. They used the same data for some of those red meat studies. And they looked at people that increased their coffee consumption by more than 1 cup a day over a 4-year period. They actually had 11% lower risk of diabetes in the following 4 years, and a decrease by more than 1 cup led to a 17% increased risk of diabetes. No effect with tea consumption. I mean, green tea is pretty healthy in many ways, especially for cancer and things, but in terms of the diabetes risk, they didn't see any impact. The decaf coffee was also looked at, and because there wasn't enough change of consumption, because they were looking at change in consumption, people just didn't change their decaf coffee habits much, so they couldn't make a conclusion on that. However, they found that people who drank more decaf at baseline seemed to have a lower rate of diabetes, so suggesting that maybe it's not the caffeine component, but rather something in the coffee itself. Can I reverse my diabetes? If you eat a plate like this. Okay, so this is a really small study, and I just threw it in for interest partly, but this was a study out of Europe, 11 people, I think it was the UK, and these were diabetics who were new onset diabetes, so I want to make that clear, that they were diabetes that had to be diagnosed in the last 4 years, and they were not patients who were on insulin or on Actos. They had to stop whatever drugs they were taking, whether it be glipizide or metformin, before the start of the study. And they were on a very low-calorie diet for 8 weeks. And this was a liquid diet formula, 46% carbs, 33% protein, 20% fat. And they supplemented with some non-starchy vegetables. So your total caloric intake was only 600 calories. And they didn't mention any dropout on the study, but it was only 11 people. So. And so the BMI fell a lot. The weight loss was 35 pounds. That's tremendous. The fat mass, so they just measured how much fat is in your body, was probably MRI machines or something, and they found that it fell 13 kilos, almost 30 pounds of fat lost. A1C fell. And remember, they took off their medications, but their A1C fell 7.4 to 6. This is really interesting. Within 1 week, their fasting glucose normalized and remained stable throughout the duration. So it affected the hepatic insulin sensitivity right off the bat. The pancreatic insulin secretion improved and was comparable to normal controls by 8 weeks. That's just phenomenal. And then they did MRIs of their pancreas and liver and found that the fat just went away and the function improved. So I think it may be that their insulin production was partly improved, but it may also be that because there was less fat in the body, their insulin sensitivity went up by a large margin. So whatever the pancreas was making was working better. But I thought that was really interesting. Again, really small study. And then the diabetes prevention trial, Dr. Singh mentioned in the last talk, but again, that looked at lifestyle changes versus metformin, and we again found that if people lost weight and exercised, they had a lower rate of diabetes, and about a 16% reduction in diabetes risk for every 1 kilo lost. So weight loss is good. We're going to now summarize. So basically, there's a lot of different healthy diets out there, and I think it can be a bit confusing. I think what you really want to do is think about what you can adhere to, what works for you. But some of the principles of the vegetarian and Mediterranean diets are particularly striking and offer advantage for both mortality and to reduce glucose levels in diabetics and prevent diabetes in those who are not diabetic. And some people really don't need a rigid diet prescription, but rather just need to think about those different macronutrients and what's good and bad within each category and just try to pick from the good. So whatever works for you. Keeping your BMI normal is really important, however you can get there. Try to reduce your sugar, eat low glycemic index foods. Try to select foods high in fiber. Avoid unhealthy proteins, unhealthy fats and oils, especially deep fried oils, because again, that free radicals. And then reduce your red meat intake, especially the processed type. So please consider sipping some coffee, minus the sugar and the powdered creamer, while you ponder these concepts.
All right, good evening. My name is Jessica Shipley, and I am one of the registered dietitians in the Stanford Nutrition Clinic. And I really like this topic. I work with people who have diabetes almost every day to help disseminate some of this conflicting information that we see. We have a lot of research and a lot of studies that tell us to eat different ways. And so my goal today is to hopefully provide you with some take-home messages or some insight on how can we take this information and apply it to our everyday lives. What I'm going to talk about in the time we have left will be to identify foods that affect blood sugar. We want to learn about, what are the healthy portion sizes of these foods? We will look at the nutrition facts labels and figure out how do we compare products and how do we use this as a tool when we're making decisions about what to eat or what to buy. And then hopefully find some ideas or develop some skill in creating healthful meal plans that will help keep our blood sugars in good range. So with that, why is good nutrition important? It's important for everybody, but especially for people who have diabetes. Eating a healthy diet can do a lot of really awesome things. It can help you control your blood sugars and your blood lipids and help prevent complications. It can help you maintain weight. A lot of times, we see people who are gaining weight, and that makes your fasting blood sugars go up. A little bit of weight loss helps you control our blood sugar. It can allow us to take less medication, and overall, eating healthy and a balanced diet makes us feel good. It can make us feel better and optimize our energy. Where does our nutrition come from? These are our main sources of calories in food, and Dr. Kenny touched on this. We have these 3 major macronutrients: carbohydrates, proteins, and fats. And each of these different categories of macronutrients give us different things in our nutrition. And in order to have a balanced diet, we want to have a combination of all 3 of these things. So pop quiz question. With a show of hands, which do you think will influence blood sugar the most? Who thinks it's carbohydrates? Do proteins influence our blood sugar? How about fats? Great, so So it sounds like a lot of us say carbohydrates are the ones that will influence our blood sugar the most. That is right. But the other foods have really important functions too. Protein does a lot of things, such as it's a building block for the body. We often think of it as, the muscle building, which it does. It helps to build muscles. It helps to keep our organs healthy. It builds our hair, our skin, nails. We know some of the food sources that Dr. Kenny mentioned. Ideally, we want to choose some lean protein sources such as chicken or nuts, beans, low-fat or non-fat dairy, soy. Fat. Fat is very calorically dense, but it's also very good for our body. It cushions our organs. It's a source of essential fatty acids. It is used as a source of energy. And our food sources are out there. We have meats, dairy products, processed foods, the oils, the nuts, avocados, and then carbohydrates. That's the one of concern today, right? What are the function of carbohydrates? Carbohydrates are our body's preferred energy fuel source, and our brain needs carbohydrates to function. It's the main food, as we know, that affects our blood sugar. Carbohydrates provide vitamins, minerals, and the big topic this evening was fiber. So what are the foods that contain carbohydrates? We have breads, whether it's white bread or whole wheat bread, cereals, those have carbohydrates. Different types of grains, we have pastas or rice, barley. Starchy vegetables, potatoes, peas, corn, winter squash, legumes, beans. This is often a surprising one. Milk or dairy products, those are carbohydrate sources. There's a naturally occurring sugar called lactose, which makes dairy products a carbohydrate source. We have juices, fruit juices, even if there's sugar added to it or if it says 100% juice, it's still a carbohydrate, as are fruits. And finally, we have all this, the sugary stuff, the sodas, the candies, the cakes. So as we see, it's encompassing. There's a lot of foods out there that have carbohydrates. And with this in mind, I hear a lot of people saying, well, what can I eat? Should I avoid carbohydrates? What do you think the answer is? Yes, no? No, you got it. There's no need to avoid carbohydrates because of diabetes. Rather, we want to be able to identify which foods have carbohydrates and then control the amount we eat. And we've learned what are those good carbohydrates and what are those ones that we might want to limit or not eat too much of. So portion control. If you know how much carbohydrate you've eaten, you have a good idea what your blood sugar is going to do. If you eat a lot, it's probably going to go up a lot. If you eat a good amount or even a little, it's probably going to go up a little. So monitoring your intake. There's a lot of different methods that we can do this. So there's methods such as carbohydrate counting. We heard about the glycemic index. We could do experience-based estimation. There are a lot of tools to help us accomplish this. We can see here that there's a lot of resources out there. We can use measuring cups. We have the nutrition facts label. We have scales or liquid measuring cups. If everybody has a hand, hold it out. Hold your fist size out. So that fist that you have is sort of, like your body's personal serving size for some kind of starch. If we just want something easy that we can use, we want to look at our fist. If you look at like a woman's fist, they tend to be about a cup or so. That's a good serving of something such as rice or pasta. If you look at the size of your hand is a gauge to use for protein sources. So if we're doing something, like a piece of chicken or a piece of fish, this might be the size we want to keep it to, about the size of your palm, which is roughly about 3 to 5 ounces. Or if you're somebody with big hands, we want to think about the size of a deck of cards or the size of an old iPhone, maybe not the iPhone 4 Plus, but the old ones. So as you see, we have a lot of tools for portion control. Well, with that in mind, how do we use these tools? And still, how much do I eat? What's a reasonable amount to eat? Well, there isn't the magic answer. There's insufficient evidence to support one flat amount for carbohydrate intake for all people with diabetes, and that's because it's so individualized. Our nutrition needs are very dependent on our activity level, our age, our gender, and it's also, based on our preferences. How do we eat? What's going to work within our lifestyle? A lot of people tend to eat about 45% of their calories from carbohydrates. But a good place to start might be, well, let's look at how am I eating now and how can I make some improvements? Where can I optimize? Am I eating rice or pasta bigger than my fist? Can I downsize that portion? As I mentioned, there is a lot of ways or a lot of methods that we could use to monitor our carbohydrate intake. If we don't want to count or measure, or we want to just find, what's the easiest, simplest way, is we want to take a look at our plate. So I like to use this in the clinic a lot. We want to take our plate and divide that plate in half. We want about half of our plate to be vegetables. And those should be non-starchy vegetables, so that does not include our potatoes or corn or peas. We want non-starchy vegetables, cucumbers, broccoli, cauliflower, Brussels sprouts. We want half of our plate that. We want a quarter of our plate to be the starch. And that would be that size of your fist, whether that's and ideally a whole grain, maybe brown rice, whole wheat pasta, maybe it's whole wheat bread, maybe it's peas here. But we want to watch that portion. The other quarter of our plate, that's where the lean protein comes into play. So take a look at that size of your palm, or remember the size of a deck of cards. Another method, this is very popular, is carbohydrate counting. And carbohydrate is measured in grams. And we'll see this measurement of grams. There are lots of food lists out there, online sources that tell us, well, how much carbohydrate per serving are there in various foods? One carbohydrate is equivalent to 15 grams. And I did bring, some of you may have picked it up, there's a handout with a list of just some general ideas there, or some serving sizes of what is one carbohydrate. So the goal is not to just eat one serving of carbohydrate at a meal, but if we want to portion control and use a carbohydrate counting method, a reasonable goal might be to start somewhere about 45 to 60 grams per meal, or 3 to 4 servings per meal. And again, this is going to be very individualized based on what are your blood sugar levels looking like? Are you exercising? How much do you weigh? So a dietitian or a diabetes educator can help mainstream this for you and give you more of a personalized recommendation. So maybe 45 to 60 sounds like a lot to some of you. Maybe it doesn't sound like enough, but it adds up pretty quickly. And here are some examples of what is 15 grams of carbohydrate. We could see that one piece of bread is equivalent to about 15 grams of carbohydrate. And that's a piece of bread maybe this big, this thin. A lot of bread now is a lot bigger, so this is where we want to look at the nutrition facts label. Some surprising foods for a lot of people are going to be something like rice or pasta. A serving of rice is about 1/3 cup, which is 15 grams. If we see this, we're like, that is nothing on a plate. But if this is going to be our carbohydrate serving, if we're going to do rice, stir fry, or put in a soup, and if we eat more than this, then we want to count that. So 3 servings of rice is about 45 grams. If our budget is 45 grams of carbohydrate at a meal, this is it. Maybe we shouldn't have the fruit or something else in that meal, because then this way we're getting into that boundary of getting too much carbohydrate at one time. The same thing goes for pasta. And I know a lot of us love pasta. And this is not very much pasta if you go to a restaurant and that's served to you on a plate. So the goal here is to be aware of portions and how much we're eating. And to get the feel of that, that's where we can use these lists and look at labels and start by measuring some of these foods at home. A lot of us tend to underestimate how much we're eating or how much cereal we might be pouring in that bowl. So we could use the serving sizes on labels, measure them at home, and that helps to give your eye a good baseline of what foods should look like for you when you go out or if you're eating somewhere else. And I do want to point out, since we do know that the added sugars, those are the types of foods we want to avoid. Well, why should we avoid them? For the purpose of the amount of carbohydrate it has in them, they can add up very quickly. 1 tablespoon of syrup or jam or jelly, honey, has about 15 grams of carbohydrate in it, and a lot of times in baked goods or soda drinks, there's a lot more of that added in, so it's going to be very quick. Up in this image that I have circled here, I put a tablespoon there for a reference, and next to that tablespoon we see 2 cookies. Each of these cookies is the size of a tablespoon, and so those 2 cookies are 15 grams of carbs. Well, what do these cookies do? Well, these cookies are low in fiber, low in vitamins and minerals. They tend to be pretty high in calories and really easy to overeat because a lot of us can't stop eating it. One little cookie that's the size of a tablespoon. Label reading. This is another tool that we can use, and all products that we find come with a nutrition facts label, or if it doesn't, we can find them on lists online. You can ask Siri also, how many calories are in an apple? And that'll pop up on our phone. So this information is widely available to us. But before we know this information is here, but how do we use it and what do we look at? When we look at a nutrition facts label, the first thing we want to look at is going to be the serving size. In this label here, we see a serving size is 1 cup. So that means for every 1 cup of this product that you eat or consume, and that's when we measure it out and actually look at what does this look like, that means all that information below is what we will get if we eat just 1 cup. We see in this next thing here, the next part, how many servings per container are there? Well, this container of this label has 2 servings. So if we eat the whole container, that means we need to double all of the information below. All of these other things, we see calories and fat, saturated fat, very important as well. For the focus of carbohydrate, that's what I'm going to focus on now, is looking at the total carbohydrate. That's what we're interested in because that's what's going to affect our blood sugar. A lot of people that I see tend to hone in on that sugar number. That sugar number is a combination of added sugar plus naturally occurring sugar. Fruit has naturally occurring sugar, and so does milk. But what that total carbohydrate number includes, it includes all fiber, it includes all starch, and it includes all added sugar and naturally occurring sugar. So when we want a good idea about how much carb is in a certain food, we want to look at the total carbohydrate number. So let's compare products. And we saw yogurt in Dr. Kenny's slide, and I'm also using yogurt, and it's one of the other ones that she showed up there because of the sugar content. The nutrition facts labels are great tools to use just to look at how many carbohydrates there are in a product, but they're also very beneficial for comparing products. A lot of times we're, well, what cereal should I get? What yogurt should I get? When we have our carbohydrate and our diabetes in mind, we want to compare. So the picture on the left is a non-fat plain yogurt. The one on the right is a flavored yogurt, and it has fruit in it. So let's look at the serving size. The serving size of the left picture, the non-fat plain yogurt, is 1 cup. That's 8 ounces of yogurt. That's a lot. The other one is 6 ounces, less than this. How many carbohydrates are there per serving in each of these products? The one on the left, this is the plain non-fat, it's a Greek yogurt, has 9 carbohydrates. If our budget for a meal is 45 grams, we can eat a lot of food if we include something like this. Well, let's look at the one on the right, the flavored yogurt with fruit. There's 33 grams of carbs in there. That's a lot, and we know some of it's coming from the lactose, but not a whole lot. Let's say we were just looking at the sugars on these products, and maybe we looked at just the plain yogurt by itself. We might see in there, oh, there's sugar. I can't eat that, but we can. That's the naturally occurring sugar, and we want to count the total carbohydrate grams. If we look at that other one, the flavored yogurt, there's 33 grams of carbs in there, 26 grams of sugar. That's a combination of the added sugar and naturally occurring sugar. So how do we find out if there's sugar added to a product? And we can use this when we're looking at cereals, if we're looking at beverages, looking at yogurt. The plain yogurt, okay, we see milk. That's where the sugar in that product is coming from. And we see some cultures. The product on the left, we see milk. What's that second ingredient? Sugar. And we might see this in a lot of different forms. It could say something molasses or honey, corn syrup. It'll say and sometimes you'll see multiple types of sugars in a product, sometimes to trick you. Well, how can we use these tools and how can we still eat a balanced diet? Let's look at this meal on the left, the top left. This is 30 grams of carbs in this meal, and look at all of that food that we can eat. And this is using the idea of both counting the amount of carbohydrate portions that we're having. We're keeping that up on the part of the plate. That winter squash, that's a butternut squash on that plate, that's less than a cup. And then we have a piece of fruit along with that. So we have a lot of fiber, a lot of color going on already. Half of our plate is vegetables, that's asparagus right there. And then we have some lean chicken, some grilled chicken. 30 grams of carbs. Let's say instead of something like that, I'm gonna go for a piece of pizza. Pizza is really tricky. And it depends on how much we eat. A lot of pizzas do not have 30 grams of carbs. A lot of them err on the side of 75 grams of carbs in one slice. And if you're like my husband who eats 5 or 10 slices of pizza, it can add up pretty quickly. So we want to keep this in mind if we're going out to eat or when we're making these types of decisions. Can I ever have pizza? Certainly you can, but how can we optimize that and keep it within our carbohydrate goals? For example, we could add a big side salad to this pizza and be able to stick to maybe one slice and not overdo it. Another thing I would like to point out is the coffee picture here. So coffee, as we saw in the study, is beneficial. But what are we putting in the coffee? And I know it's fall, there's a lot of really fun drinks out there, eggnog lattes, pumpkin spice lattes, mocha, mints, everything. And so what do these products have in them? Yes, it's coffee. A lot of times they're made with milk, so we have carbohydrate from the milk, but we have a lot of added sugar in these things. So it's really important to be aware of how much sugar goes into these drinks and control the amount that we eat. Another tricky one are bagels. Bagels tend to have about 60 grams of carbohydrates and they're pretty high in calorie. What do we put on bagels? We put cream cheese or bacon or whatever else comes on bagels. Let's compare that 60 grams of carbs. A bagel is not that much food, really. If we look at this other plate that's in the bottom middle, this is a huge plate of food for the same amount of carbohydrate portions, plus it's very high in fiber. We have quinoa in here, we have spinach, we have that squash again, we have a lean protein. We're getting some milk or some soy milk. So we have a lot of variety, a lot of food that's probably gonna keep you full pretty long. Eating out. Just because you have diabetes doesn't mean you can never eat out. You can still enjoy that. What we may wanna do is plan ahead or review the menu online. We wanna try to stick to our goals, whether we're eating out or if we're eating in, by understanding what portions might be healthy for us. Restaurant portions, as we know, tend to be large, and if we go to certain restaurants, we might get that bread basket coming to the table, or we might get those chips at the table, and we're looking at the menu, eating, and before we know it, maybe that basket of chips are gone. Maybe that whole loaf of bread is gone, and by that point, maybe we've eaten 75 or 100 grams of carbs. So you want to be aware of that. In this picture, I actually took out a portion of chips from this basket and put it on a plate. That's 30 grams of carbs from those chips. It was just a handful of chips. So when we're mindlessly eating or eating at restaurants as we're looking at the menu or chatting, we could be eating things that are going to have a significant effect on our blood sugar. We want to be aware of that. So we might want to eat off of smaller plates, portion things out, and this is where we practice this at home and get our eye used to what might be a good portion for us. We can mix and match menu items this way. This is an item that my sister sent to me. She went out to lunch a few days ago and she said, hey, look, I got a big salad and dressings on the side. Do you approve? Right? I said, that's a great idea. And I thought this was great too for eating out. We can mix and match foods our way. Getting dressings and sauces on the side is often a good idea. That way the amount that we're eating is in our control and we can be aware of it. Another thing is that a lot of these dressings and sauces, they tend to be laden with added sugars or even salt in them. And those are things that we want to moderate. When to eat also plays a very important role. Eating at regular times can help control our blood sugars and helps prevent hypoglycemia, especially for individuals who are using insulin. Eating regular meals helps you feel satisfied and helps reduces chances of overeating later. Have you ever gone, a period of time when you had to skip a meal and you're really hungry? What happens? Well, usually something like pizza ends up looking really good, or that bag of chips sitting on the counter looks pretty awesome. So when we start to skip meals, we get into the place where our blood sugar gets really low, but then we also get into these habits where we feel really hungry and we crave those foods that help raise our blood sugars so we're feeling good again. So we might want to aim to eat something about every 4 or 5 hours. And what we eat, we've learned a lot about this tonight, things such as protein and fat and fiber. Those 3 pieces each help blunt the effect of carbohydrate on our blood sugar levels. Protein and fat tend to digest much more slowly than carbohydrate. When we pair those things together, it helps to keep us full longer. Fiber, as we know, we want to choose the whole grains, fruits, and vegetables. We want to choose the low-fat protein sources and the healthy fats. And there's also no one perfect food. The goal is to include a variety of foods and watch our portion size. What are our guidelines for type 2 diabetes? Losing weight if you're overweight. And we can do this by portion controlling. Let's look at some places where maybe we're eating too much, or maybe we're not, half of our plate maybe isn't vegetables at this point, or maybe we're adding a lot of sugar to our beverages. These little places that we can find where we can reduce overall caloric intake, whether it's coming from fatty meat or extra added sugars, help to reduce our overall caloric intake, which helps to support weight loss. And we know that weight loss is beneficial for those who are in need of weight loss or who desire weight loss to help support improvement of diabetes. Exercise is another beneficial piece, and that was spoken about during the last session. So I wanted to encourage exercise as long as it's safe for you and your physician approves exercise for you. This is another key on how we can use, in addition to our diet, to help support or maintain weight loss and to improve our blood sugar control. I want to reinforce that everyone with diabetes is different. So just because maybe your friend or you know somebody who'd said something or they read something, they're doing something, it might not mean it's right for you because everybody's needs are very different. We might be taking different medications, we have different preferences, we weigh a different weight for different ages. So a dietitian or a diabetes educator can suggest very specific goals as far as your carbohydrates or calories go. There are a lot of resources out there, some very helpful resources, and they're endless. There's a lot of phone apps, like I mentioned. One, if we're looking at, we want to know how many calories or what's a serving size of an apple or how many grams of carbs are in something. MyFitnessPal is a good one if you want to track all of those numbers, or if we just want to look something up because we're not sure, Calorie King, that's another good resource. There are a lot of education resources where we can continue to learn more and find really good evidence-based information. The Stanford Health Library is one place to start, as is your healthcare team and asking a dietitian. In summary, good nutrition is one of the keys to managing diabetes. Our guidelines focus on controlling carbohydrate. It's not about elimination, it's more about the regulation and which carbohydrates are we choosing to eat more of. And everybody's journey is very different. We all come from a different beginning. Maybe some of us are already carbohydrate counting. Maybe some of us, this is all new to us. So the goal isn't to do all of these things or try everything at once, but pick one thing. Pick one thing that we could really focus in on and learn. And make it a measurable goal. Maybe I'm going to add 1 teaspoon of sugar to my coffee instead of 2. Maybe I'm going to not go get the mocha flavored latte every day. So these little changes add up to big things. So remember, it's one step at a time. Thank you.
Take questions? Yeah?
Questions? When you identify, let me bring you a microphone.
Question back there and then turquoise.
The think thin bars, they say they're better because they just.
Okay, sorry.
About
Could you repeat that?
alcohol sugar, is that really different from other sugars? Like they say the think thin bars are better because they have only alcohol sugar in them?
I'm going to let you take that, Jessica.
Sure.
I'm not.
Sugar alcohols are very tricky. When we see sugar alcohols on a label, what those sugar alcohols are is they're still a type of carbohydrate, but when you see something on a bar that says, maybe it has 6 sugar alcohols in it, that means you might see a word, it might say net carbs. The net carb of that might be 3. Sugar alcohols, only half of those amount of carbohydrates are actually absorbed and affect our blood sugar. But sugar alcohols also have some negative gastrointestinal effects. Some people get diarrhea or gas or bloating from eating them. But overall, it's a way that products can have less total carbohydrate in them because some of those carbohydrates are coming from sugar alcohols. It's less total carbohydrate.
Yeah, and I did say that most snack bars seem to be pretty high in sugar, and looking at them, it seemed like the kind bars, or kind, I think, are largely nuts and not as much sugar. So if you really need a bar, I find that that's probably a healthier bar choice. Sure.
What's A1C?
Okay. Or I can repeat the question. Yeah, what was your question?
What's A1C?
What is A1C? Okay, sorry, we threw that term around a lot. A1C is glycosylated hemoglobin. So those of you that are diabetic will know it. It's a measure that we check as a 3-month average of your blood sugar. And the reason for that is that red blood cells have a lifespan of about 3 months. And so the average glucose in the bloodstream attaches to the red blood cell. And so if we measure that red blood cell and how much glucose is attached to it, we can guesstimate what their average blood glucose has been doing in the last 3 months. But it's more heavily weighted to the last month. But it's a 3-month measure. Okay.
I saw on some of those labels that they had a fiber listing for carbohydrates. Do you get to subtract that from the total carbs to get to a net carb? And is net carb meaningful?
Yeah, it gets really confusing. So a lot of times I try to make it simple. That's an excellent question. So what we can do, if we are carbohydrate counting, if a product has 5 or more carbohydrates in it, it's believed that yes, we can subtract that amount of carbohydrates from the total carbohydrates, making the overall carbohydrate less. And that's because fiber is a non-digestible carbohydrate. Our body doesn't absorb that.
Okay, so additional questions? Oh,
I noticed you said that we should eat every 4 to 5 hours and eat regular meals, but I was wondering what's wrong with just eating when we're hungry?
That's going to be very individualized. As far as when somebody is diabetic, eating regular meals is a great way to help support healthy blood sugar levels. When we go long periods without eating, our blood sugars can get lower, and then that can lead to wanting to eat a lot and then spiking our blood sugar higher.
yeah, and studies have shown that people that eat breakfast tend to be thinner than those who don't. And so probably people that starve themselves too long overcompensate the rest of the day. That's one theory. Another theory is that maybe it alters the metabolism if you're starving for too long. But in any case, it is good to kind of keep regular food intake going and don't skip breakfast, even if you're not hungry. A lot of my patients say, I'm not hungry till noon. Well, just eat something, even if it's just a small piece of fruit, just eat something. So,
Could someone elaborate a bit on spiking of blood sugar versus the same amount of sugar over time so that the integral is the same? Which is worse?
okay, I think you're saying, so the area under the curve being the same
yeah.
versus being rapid versus slow. And so I think the key thing is that if you're diabetic, it's estimated that you've lost about 50% of your beta cells at the time of diagnosis. So the pancreas is not as efficient as a machine. And so if you have a rapid spike in your blood glucose, the pancreas is not able to accommodate that as rapidly with a bolus of insulin to match that glucose spike. Whereas if the glucose, that same amount of glucose went into your bloodstream over 4 hours, that pancreas could accommodate that with insulin secretion over that 4-hour time, as opposed to having to have as high a spike in that first hour. Does that make sense? So the pancreatic...
Yeah, it all makes sense, but even if you're not diabetic and your pancreas, my understanding is that if your pancreas is working, you still get a higher blood sugar reading after a meal. And the question is the damage done from that the same as if you slow that down over a longer period of time?
So when you say damage done, are you talking about glucose toxicity to the pancreas or glucose damage to cells?
Both.
Okay, so
Either,
because...
yeah.
I mean, there actually was a study that was just published in the last year, and it basically showed that people who have an average glucose reading that was approximately 115 versus 100 had a higher risk of Alzheimer's dementia. So that would argue that probably having higher glycemia in the bloodstream is potentially problematic for the tissues, even if you're not a diabetic. But so more studies to come, and that was, it was a study of borderline statistical significance. But I think my belief is that probably if you have an average blood sugar that's pushing the limits of diabetes, even if it's not diabetic, that may be harmful to your nerves and other organ tissues. And so it would be better to not have those spikes. And then there's the whole concept of glucose toxicity to the pancreas, and that's typically seen in diabetics who have extreme hyperglycemia, and they may have a blunted insulin response until they correct that hyperglycemia, and then some of those cells may come alive and they may get better insulin production as they get their glucose levels down. But that's usually seen at levels much above 200. So.
What is the difference between the A1C and the blood glucose monitor? Do I have to have both or just one?
Great question. So the A1C, as I mentioned, is looking at the glucose attached to the red blood cell. So it's giving you that weighted average over a 3-month period of time. So that's probably a better way to gauge what's going on with a type 2 diabetic than one random blood sample. The reason we have people do home glucose monitoring is because it gives them feedback on foods that they're eating and how much glucose rise they can see with those foods. So and then those patients who are on insulin have risk of hypoglycemia. And so we like especially patients who are on insulin, to be checking their glucose regularly to check for those things. If you're a type 2 diabetic and you're only on oral medication, you really don't need to be checking your glucose that often. I mean, as I said, it's helpful as a feedback mechanism to sort of learn what foods are higher glycemic. But as far as management, the doctor's going to rely most on your A1C. Does that make sense? Okay.
Isn't fiber the chief source of bacteria-generated gas?
Yes. Yeah, so as I mentioned, fiber is undigestible carbohydrate, which ends up in the colon, which gets fermented, i.e. gas can be the consequence. So that is one negative I didn't talk about in my talk, but yeah. Okay.
I know you said that you didn't like diet sodas, but actually I love my Diet Coke, and I'm pretty sure I can't give it up. Okay. So I've always thought maybe that could help as a way to provide something sweet that doesn't actually have the real sugar.
Yeah. Well, again, I mean, the theory here is with diet sodas historically has been that when you eat something that's like an artificial sweetener, that your taste buds sense something sweet, and that the brain then waits for the sugar to arrive, and it doesn't arrive, and that the cravings then go up after the fact. So, and there are some studies that show that willpower and cravings may be worsened by intake of artificial sweeteners. So that's one theory. And then this recent thing that came out, as I mentioned, in the last year, which was that the flora changed with artificial sweeteners provided to the diet. And so perhaps the flora is not as healthy a flora, and that flora then promotes weight gain and insulin resistance. So I think there's more to come on the so-called microbiome. That's the term for the colonic flora. I think there's a lot of interest now in health and human disease and how that is impacted by the flora. So I would encourage you to see if you can try to scale it back at least, or I tell patients try to switch to water that's flavored with cucumber or lemon or non-sweetened iced tea as an alternative to at least sub out some of the Diet Coke. So,
I have a hard time reconciling the studies of the vegan and vegetarian diet with the low carb goals, because a vegan diet is getting most of its protein from carbohydrates and must be a pretty high carbohydrate diet.
Yeah, and I pointed that out a little bit in my talk, but that one diet was a 70% carbohydrate diet, that one vegan study. So I think the problem is that for a lot of people, they don't choose the right carbohydrates. I don't think carbohydrates are evil. I think you can lose weight with a high carb diet. It's just that for most people, they need to be on a low carb diet to avoid eating the chips and the crackers and the breads and the things that are unhealthy. If they were able to eat all tofu, beans, and fruits and vegetables, and live like the Seventh-day Adventists, I think they would do just fine, and they'd lose weight. Remember, they had the lowest BMI. So it's just that people have a hard time. Some people need things to be very simplified, and it's all out, no carbs, so because they can't choose the right carbs. So I think it's not about having to be low carb, although the adherence rate in that one study, if you were insulin resistant, you had a higher adherence to a lower carb diet. So.
Hi. Getting back to the microbiome and intestinal microflora, I was wondering if there were some positive effects from the usage of probiotics. So I don't know if it was mentioned earlier. So if you could touch base on that, that'd be great.
I mean, that's a great question. I encourage a lot of my patients to take probiotics, certainly for irritable bowel syndrome. I think they're very healthy. There's some studies that show better immune function in kids having fewer illnesses and things. So I do think probiotics are healthy. Now, whether they promote weight loss, I don't know if there's strong enough data on that yet, but that's an interesting area for study.
I was curious if stevia or Truvia was thrown into the artificial sweeteners discussion, just because that's what I use instead of drinking diet soda, and I'm just...
It's a very good question. Yeah, I mean, I think the study I alluded to, which looked at flora change and insulin resistance, did not include stevia. I have to go back to it. I think it included aspartame, saccharin, and some of the other artificial. I mean, again, the whole argument about maybe your cravings go up if you're eating something that tastes sweet, but you don't get the sugar that follows. That would be true for stevia also, but so I don't know the answer to that. Sorry.
Yes. I, for one, would like to review what you have presented here. Is there a website where I can look at these slides? Or?
Well, Nora, we have notes that have been taken copiously on the presentation, and they'll be available, and then...
Okay.
So you'll be able to watch it in a couple of weeks.
Okay, good enough.
Okay.
I had a question about the starvation study, the preventive study.
Yes.
I mean, 600
Yeah, I'm not necessarily promoting that. I just thought it was interesting.
I was just curious if there was a follow-up when these people went back to semi-normal eating. Did their glycemic index go back up?
I haven't seen it. Yeah, and this was only published in the last 6 months, this trial. It was in the last year, certainly. It was a recent trial. And it was only 11 people. But so it would be interesting to know what happens, after you go back to a regular diet. You probably gain back a good portion of that weight, and but yeah, I mean, I think more studies need to be done. I think that the adherence rate, certainly for a 600-calorie diet, is just going to be horrible. But I think what it means is that I think the extrapolation here is that for those of you that are heavy or overweight, losing weight is going to promote, it's going to improve your glycemia, and it may promote better insulin release from your pancreas. So that's, I think, a good take home.
Thank you all very much for coming tonight. And thank you, Dr. Thank you.